Thank you very much for including me in this panel of such eminent personalities. So I'm very humbled. And regarding how the pandemic has affected Nepal, it's as has been
especially in rural areas, sorry.
Yeah, especially in the rural areas. The pandemic's second wave has finally reached the rural areas. It looks like it's spread in a much more scarier way than we had previously anticipated in this last month or two. And so there are areas where there are no tests available. There are no PCRs, no antigen tests, and or whatever tests are available are not performed in the right way. And then and there are people dying even without the dignity of having a test, this has exposed so much of our systemic failures in so many aspects of our lives. So the government did not really have a functional public health system, which is in a way, a great equalizer, in terms of, bringing in, giving people opportunity to flourish and, at least saving lives that, can be saved. So we didn't really have a public health system. Whatever we had in, vaccination programs, the childhood immunization programs, the maternity care programs, even they are affected in a significant way. And the long-term impacts will be, documented much later. So we really won't know the real impact for many years. So there are villages where there are no doctors around. There are villages where there are no tests available, where there are villages where people are having fever and cough, and there is no pulse oximeter to even measure oxygen saturation, needless to talk about oxygen or other treatment. So this has been a very serious situation in the villages. And millions are back in below the poverty line. Even after the first wave, there were already 7 or 8% more of the population that was going back into poverty threshold, below the poverty line. And so we don't know the data since then. I'm sure in the last few months during our second wave, which has been which has hit us much harder, those numbers would be much worse. So it's been terrible. So again, women are the majority of the frontline workers, especially in healthcare, in Nepal also. And we have a very large community health worker, volunteer community health worker workforce that played a very significant role in whatever services could be continued during the lockdowns and during the pandemic. And they were not prioritized for vaccine, for example. All the hospital doctors and nurses were offered vaccines, but they were not offered vaccines for a long time. And even now, the majority of them are not vaccinated. There are nurses who cannot go back to their homes because they are taking care of COVID patients. They cannot go back to their apartments or their places where they have rented because of the stigmatization. There have been threats and threats of violence against healthcare workers because of the stigma. And so we have sometimes failed in taking actions to protect them. And they have been through terrible stress. There are a lot of burnout and mental health stress-related issues that have not been addressed by as a system. We really haven't even seen that as a problem so far. So especially the women healthcare workers are probably bearing the worst.
But I wanted to talk to you when you brought out mental health, and I'm so glad that you brought that up. There was a, when I was researching this, I read your interview where you talk about, and very eloquently, it's a one quote where you said that doctors are not trained to do this, and you said you have to send back people because there are only X number. I think I think there were only about the ventilators were only some in hundreds, and you said that you have to turn back patients, and doctors are not meant to do this. We are not trained to do this. So what about how has this been? How has this impacted you? Because in India there was this tweet that went viral about this one doctor who talks about every night at the end of her shift, she lets patients who were going to die, who are terminal, get a chance to say goodbye to over a telephone, right? And she said this one patient, her son sang this song, Tera mujhse pehle sa nata koi. I mean, you and I have a relationship which goes beyond this thing, and it was a very popular Hindi song. And she said he sang that song, and the whole ward cried. And she said that's not what we were doing. We are meant to save lives. We are not meant to be able to see this, and the death toll has been enormous. So how have you coped with it, and what has it really meant to be able to deal with this kind of COVID code? Because I don't think we've ever talked about how doctors do on the burnout they face.
It's been very stressful, and it's been very stressful not just for because we cannot provide the care we are supposed to provide to our patients. We have failed our community, failed our relatives who call us to help, and that's the kind of anguish we go through. We also fail to work as function as parents, as sons and daughters that we normally are. We are members of a family, members of a community, and when we are completely obsessed in the pandemic response. So there are so many threads of thoughts that we have to go through. And it's probably the same in India and other countries in this area where the healthcare workers burnout or mental well-being is not a priority, or is not considered something that needs to be looked into more carefully. I'm sure things are similar in all the countries. And in Nepal, I consider myself actually luckier because I work for a much well-provided hospital in the city, but I'm sure the sufferings of the nurses who had to, take care of patients in the villages, or community workers who had to take care of patients in the villages while they were themselves sick. While they were themselves having COVID, while their own family members were sick, and they didn't have paid sick leave, they didn't have, paid quarantine leave, and a lot of them actually also had loss of income because we have this healthcare system where a lot of the patients are seen in the private for-profit system. The healthcare workers don't actually have any social security or any extra benefits. And when there was COVID, their salaries actually were slashed back significantly. Yeah. And they were dealing with much higher threat of even dying without having proper access to personal protective equipments and all that, and also having a loss of income, and worried about spreading the disease to their families, and also not being able to do what they are supposed to do because of lack of resources for the patients. So this has been a very difficult situation. I myself actually I feel luckier, so I really I think the people working in the villages or in the more rural areas had a lot worse situation than mine. That's a very important question, and a lot of our prominent doctors were trained in India at the beginning, and even now there are hundreds of doctors who go to India and to Bangladesh and to Pakistan to get training. It's a good question. I think we haven't really, especially the medical fraternity, has not really evolved into sharing ideas into going for a pan-regional kind of a coalition, sharing ideas, inspiring each other, that kind of mode. That's probably one reason. We have been more focused with our own, national or local issues. The other thing is here the doctors have, so if you compare to those working in the United States or Canada, other countries, their doctors actually have much more time in their hands, to build coalitions, to communicate with other people. Here, most of the doctors I see are just rushing between patients all day long, so that's probably one important reason that we kind of ignore. And then there is probably this awareness, less awareness, or people don't have time to ponder that we actually share the same issues. We actually share the same deficiencies in our healthcare systems, and poor quality in our healthcare education that is probably affecting us all, and maybe we can work together to improve that. So
Yeah.